AIDS.gov recently attended the Black, Gay, and Bisexual Men's HIV/AIDS Summit, Putting the Pieces Together, convened by the U.S. Department of Health and Human Services. We spoke to Dr. Timothy Harrison, the meeting facilitator, and a cross-section of panelists who spoke at the meeting.
We're here today to discuss HIV/AIDS and its impact, the questions and issues affecting Black, gay, and bisexual men. We've brought together a number of stakeholders from community, from research, from government, state and local, and federal, and we're here to discuss some solutions. What we talked about today are three main areas of concern: biomedical advances, stigma and structural determinants of health, and capacity building within communities.
So for Black, gay, and bisexual and other men who have sex with men, the factors such as racism, homophobia, and poverty, and as well as HIV-related stigma solely based upon HIV as a bad outcome in society, can have very detrimental outcomes for the health of these men.
The panel discussion was about capacity building for organizations and for health departments and what could be done to actually help agencies sustain themselves as they transfer from HIV prevention to comprehensive, inclusive Black men's health. The panel talked a lot about things in four particular categories: tips, tools, techniques, and talents, and what that would actually mean for changing the landscape as we go from more of a public health model to a clinic or medical-based model, and how we can actually shift to make sure that Black men are at the center of those health ideas and that they come into a safe, secure, and nurturing environment for those healthcare needs.
Now more than ever, there are all kinds of ways that people can protect themselves against HIV, number one, and if people are infected, there are more incentives to start treatment early. The treatments are better than ever, the treatments are less cumbersome than ever, so there's really a lot at stake for people to know their status and to be able to engage in the healthcare system. There are many community-based organizations around the country that can provide support for people, and I strongly urge people who are watching this to think about your individual behaviors and think about where you can get support.
There's a group of committed people who care. We need you to make this end. We can end AIDS today if we all decide to get involved and do four simple things. We want you to get the facts, know the facts, use the facts, and share the facts.
For more information on HIV and the national response, visit AIDS.gov. And to join in on the conversation, follow blog.AIDS.gov.